Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we are going to educate you today a little bit about vitamin D. A lot of you already know about vitamin D or you're beginning to learn it, but I think that, one of the burning questions that we seem to be having is how much vitamin D is right for me. And there's really, it's different for everyone. And there was a book called The Optimal Dose that Dr. Lewis read. There was some other of our clients that asked about that book. They wanted to know, well, how much do I take? Because I think it was very high levels. And Dr. Lewis is going to answer all that for you today. He's going to help you discern how much is right for you because there are other factors involved besides just loading up on a bunch of D. And he's going to tell you what can happen when you do too much of that. And we are also going to answer a whole lot of questions that we've received from our audience via our Shootin' Straight with Dr. Lewis Facebook group. And if you're not a member of that, all you have to do is go there and ask for yourself to be invited in, either by email or send him a message on Facebook, and he'll accept you. You can be part of our community. You can also answer or ask us questions online. There's an online form for the podcast. So anything we don't cover here today that you still want to know or any other topic, please reach out to us that way. We try to work it all in and make it a very enjoyable show. So Dr. Lewis, vitamin D seems to be the thing for immune system right now. Can you tell us how much, what the difference is, and is there anything wrong with just loading up on it?
Have you ever been just one drink away from telling people what you really think?
Never. Not ever.
I have been quite often. I'm going to talk a lot about this. And, it's absolutely amazing. Facebook, the Shootin' Straight has been a good thing. There's people that follow me there that actually work for some really big supplement companies, which has afforded us, Janet and me, an opportunity to do some really big things. I was called Salt of the Earth yesterday, which I thought was funny.
In Longhorn, Texas as well, so we thought that was even funnier. We've renamed our town from Longview to Longhorn now. I love it. I guess they associate that with, steers in Texas. I don't know.
Yeah, that was kind of funny. I've got a lot to say. And this all started about 5 years ago when I was on a podcast as a guest from Jack Spirko, the Survival Podcast. And he is crazy, crazy smart, incredibly intelligent. He really knows what he's talking about. And he's certainly blunt about giving his opinion. And you need to listen to him. But I got a lot of people from being on his podcast, and people would say, I've taken 5,000 or 10,000 IUs, and of course I'm looking on lab, and I said, well, it's not working. But I'm taking 5 or 10,000. I said, it's not working. Most supplements don't work, and some of them are actually very toxic to you, and there's reasons for that too. I finally did the percentages on it with the help of my accountant because I'm not good at percentages. Oh, good Lord. I skipped that class in high school, probably went fishing or something. And it was 93% of what people were buying and taking was not working. 93% your odds of getting something that's good. And Jack Spirko was talking about it. And again, Spirko's a really crazy smart guy. Y'all should check him out. He's really good, and he'll tell you what to do during times of stress and trouble, where I'm just good for telling you how to be healthy, which is not bad too. And I was in Tulsa, and he was talking about that, and I was getting involved in his Facebook group. And he said, well, you ought to order this book, and, it'll change your paradigm about what you think about vitamin D. And I said, well, the book's already been ordered. It's on the way because, I read books all day long. And, I don't know that it's changed my paradigm. I try to push it anyway, but I do think what this book outlines, which this guy says take 30,000 a day, it's like, well, no, don't do that. Not without testing. And This is from the book, not from Jack Spirko. One of the things that people talk about is, I can't sleep. Doc, do you have any kind of thing for sleep? Well, if you're low in vitamin D, that can cause you to not sleep real well. You know, D3 plays a very pivotal role in the body achieving the state needed for deep sleep, and that's very, very important. And I have people that take, 5,000, 10,000, and some of them, it gets them up where you need to be. I think the sweet spot's 100, 75 or 100. This book says more than that, and there's no evidence of it being toxic. But again, there's more to that, so I'm going to teach you that. But when your D3 levels are optimal, your immune system, the depth of sleep, and the rest that you get there, and your metabolism becomes primed to function more at its greatest potential. So, I think that needs to be done with lab. I think it's very incredible. And, I really appreciate y'all listening. I'm backtracking a little bit. I was talking to James down close to Savannah, Georgia, the other day, and he said, well, I heard you on this other podcast. And even though this other podcast has a lot of other doctors on it, some of them way the heck more famous than me because they wrote a book or some crazy, stupid stuff like that. And he said, but I had to listen to you and see if you were the real deal. And I listened to 10 hours of your podcast. I said, well, apparently you need something for stress. And one thing I want to tell you about stress during these times, we're in some stupid, crazy times. I can't believe the people that jump into this stupidity and allow themselves to get all bent out of shape. Easy Relax is better than alcohol. This Easy Relax, I finally opened up a bottle and said, Janet's looking at me like, where the hell are you going? It's like, well, I don't know.
I'm waiting to hear more about vitamin D.
I'm getting there.
Okay.
I hope. And Janet always reels me back in. Easy Relax is really, really good to help with that deep sleep because it has all kinds of things in it to make the neurotransmitters. And because I said D3, optimal levels, helps you get in that deep restorative sleep stage. So try Easy Relax or just the straight GABA can work real well as we're beginning to optimize your vitamin D because that takes time. Some of the things that vitamin D3 helps, and it's not the D2 that some doctors will give you at 50,000 a dose, which is not very absorbable. Restless leg syndrome, the deep restorative sleep, waking up full of energy helps actually to eliminate snoring. And it's like, wow, that when I read that, it's like, yeah, okay, maybe that's why I used to snore, and now I pretty much don't, and Janet doesn't much. Helps allergies, yeah, because the immune system stimulation helps eliminate influenza. I read some research the other day that said if it gets over 70, your D3 levels, you pretty much can't get COVID. Yeah, we can't make any recommendations about supplements and COVID, but what if your immune system was allowed to do what it's meant to do, and it's not a conspiracy theory that you think you have an immune system because God gave it to you. It really helps correct autism spectrum disorder. And I've talked about that before because autistic kids have the lowest levels of vitamin D, and we're all low, but they had very, very, very low. And women with very low vitamin D are much, much more likely to have kids that are autistic because vitamin D has to do with detoxification. It can slow down, in some cases actually eliminate dementia, and yeah, it's a pretty complicated study. Alzheimer's. Some people even say it prevents Lyme disease and other viral diseases, and I think that just because it boosts your immune system enough that your body can take care of the little booger bears that come in when the tick bites you. There's all kinds of studies about D and cancer, either in prevention or treatment. Again, that shouldn't be the only thing you try, and that's the problem with LIST. Is people will say, well, I've got cancer, I'm just going to do vitamin D. No. You've got to go to a cancer specialist that understands the benefit of nutritional products and how that can help your body fight off. It really helps restore body weight. And, I'm 5'10", 5'11", 182 pounds. So, and I'm trying to be nice, but there's a group of people that are very, very, very close to me, and I'm the only one taking vitamin D, and I'm the only one that's not 100 pounds overweight, and that's as nice as I can put that. It helps block excessive fat absorption, boost your metabolism 20 or 30%. That's why I'm 65 and feel 35, because I take the holy heck out of my own products. It helps boost muscle strength 30 to 40%. So when I tell Janet, no, I'm too old to pick you up, I'm just lying. I'll carry you through the threshold again if you'd like.
Through it is probably the really close answer to that too.
Don't bump her head when I go through. It boosts energy level, but now again, don't just get all excited about this list in vitamin D, because there's so many other things that'll boost your energy level. It slows aging, because Janet several times has said I'm way too young for her. Well, I have to work at it, and I have to take a lot of stuff, and God only knows what she puts in my drink. I don't have a clue. It helps fight off different bacterial infections like MRSA, and I think that's one of the reasons I didn't have it when I got the spider bite years ago. And they said, look, everybody, the last 50 people had the MRSA. Why don't you have it? Well, I was on vitamin D and olive leaf, and they couldn't understand. They'd swab the spider bite and swab my nose, and they said, we don't understand why you don't have it. And they even sent other surgeons in to check me. It helps with diabetes or the metabolic syndrome that leads up to diabetes and all kinds of other things. But there's a lot of resistance to the so-called parameters, the reference range, which is 30 to 100. So if your doctor says, yeah, you're okay because you're 32, it's like, oh, good Lord, that's not even close. That's like saying, well, I've got an eighth of a tank of gas, but I'm going on vacation. You want to fill it up, get close to 100. And I've read plenty of research that says vitamin D doesn't get toxic till it hits around 140 to 150. And then there's other research that says it's not even toxic at 300. I've seen a few people come in where they had their levels at 200, and I'd tell them to back off because, I'm not the research scientist, but I think 75 to 100 is a sweet spot. I really do.
Well, I want you to go back to, why I think part of this book was written about taking high amounts of vitamin D. I personally think it's because of what they're selling over the counter in the stores. It's not going to absorb very well. So is there any, for us, with what we sell here, Dr. Lewis is required to have an active license to actually purchase these products that we sell to you guys, which means I think they're not doing that in your health food store. I don't know of anyone in there that has an active license of any sort to do that. So if you're going to a health food store, you probably do want to take a higher amount because it isn't going to absorb as well. Where for us, when we look at lab and we give you that product, it's going to absorb a lot better because it's actually pharmaceutical strength. It's like practicing green medicine. And the other part of that is, one thing that really gets overlooked when you're taking vitamin D is the carrier that it needs to get in, which is K, correct? Which I wanted Dr. Lewis to talk a little bit about K, because K, just to put it where you can kind of understand it, people are always worried about their calcium levels, and they take D to help the calcium.
Yeah, and higher calcium on your lab is not a good thing, folks.
That just means it's out in your bloodstream. That don't mean you're using it.
Yeah, it's not in your bone necessarily.
Right. But calcium is kind of like a hotel guest that comes to the door. Well, vitamin D is the one that actually opens the door for calcium to come into the lobby of the hotel. But once calcium gets in the lobby, he doesn't know where to go. So K, vitamin K, is the bellhop that actually comes down and picks up calcium and takes it to the room. It shows it where to go. So poor old K gets overlooked as just a little leper over there. Can you tell us a little bit about the benefits of putting K with D?
Well, yeah, briefly. And you have to be very careful. And there's different kinds of K. You have to be careful. If you're on blood thinning drugs, don't go there. The thing about it is you really pretty much will never see symptoms of vitamin D toxicity, which can cause inappropriate calcification if you take K2. That's simple as I can put it. It protects you against toxicity. And one thing people really don't understand, they come in and say, well, my doctor says take calcium for my bones. It's like, no, you don't understand. But in order to get it, really, you need magnesium probably more than calcium. And most people don't understand your bones 50% protein. You've got to have, if you have a vitamin D deficiency, you will not have optimal amounts of magnesium. And you've heard me talk about everybody's deficient in magnesium because you just can't get it out of the soil. Even people that are taking magnesium don't necessarily have the red blood cells spun down magnesium test on a high level. So they all work together. So don't just get all hyped up on one thing, please. That's not a smart way to do it.
Yeah, for all the people that come in, say, over the age of 30 or so, or the ones we see their lab work, we generally always put them on the D3 plus K2 because it's a lot more absorbable than taking straight vitamin D 5000. We have vitamin D 1000. That's for kids or mostly kids or people that just don't know any different to take more vitamin D.
People that want a quarter tank of gas to go on vacation, they don't want to do the whole thing.
And then we have the vitamin D 5000, then we have the vitamin D plus, or the D3, D3 plus K. Is that what it's called?
D3K2 Ultra.
Okay. Well, and it's the menaquinin. Is that how you say that? Menaquinin 7, the MK7, which is what makes that one work so well. That's the good stuff, folks. It's the good stuff. It's not just, let's go put some K in there.
So, and the other thing is, vitamin D improves the absorption of magnesium, and magnesium, of course, is good for metabolic syndrome, making insulin, And there's at least 300 different enzymes. Magnesium works on brain function, so that can help with depression, anxiety, all that. But if you get too much vitamin D, it actually can deplete magnesium. So it's a balance. And I tell you, don't get on the internet. That'll just make you an educated fool. I'm not saying it personally, but educated idiot. A lot of people get a little bit of information, they run with it, and it's like, no, please, you got to get the big picture. I don't even treat myself. So the K2 is very, very incredibly important. What else you want to talk about?
The other thing with vitamin D, it is also huge for rebuilding lung tissue, which is why they say that it may be good for respiratory illnesses.
Yeah.
So keep that in mind.
Higher levels.
I want to make sure that we answer some of these questions because these people have been very patiently waiting for their question.
Or maybe not patiently. I don't know.
I don't know if they've been patient either, but they've been kind enough to wait. So we're going to start with some of these, and we'll let you get back to vitamin D if we have some time for that still.
Because I want to talk about Dr. Gomenak.
Who?
Dr. Gomenak.
Who's Dr. Gomenak?
Well, she's famous. I'll get back to her.
Oh, okay. All right. We'll have to remember that. All right. Connie is having issues with swelling in her right hand and fingers, mostly her index finger. Pain in her feet and ankles when she wakes up. She's thinking she needs something for joint pain issues. And she's getting ready to put in an order. We didn't get to this question real fast. I don't know if she went ahead and ordered or not, but what supplement would you recommend for joint pain?
So if you want a quicker answer, maybe just call me, Connie. We have the Joint Max, which is really good. There's, the chondroitin glucosamine. It helps the sulfation pathway through the liver. Yeah,
we have joint support formula.
Yeah.
But if people are allergic to shellfish, then they can do the Joint Max, which is the other one that's not got the shellfish in it.
You have to watch the swelling because there's all kinds of potential medical conditions. If it's a big deal, and especially if there's a difference in temperature or pulse strength, you probably need to see your MD because there's a possibility of having a clot there. Although we have things that are clot busters like the good vitamin E and nattokinase that can help. The bromelain or quercetin bromelain can help with that too. So good answer. All right, Andrew has a question.
And Andrew, I would like to thank your wife, Kara, for checking on us during the hurricane. She was kind enough to reach out to us on an email and ask if we were doing okay and offered her home to us to come up to. It never got that close to us. We're very grateful. It was about 30 miles from us.
Yeah, it's a non-event.
Yeah, but that was very sweet, Andrew, that your wife would ask about us.
We know she's brilliant because she married you.
That's true. His question is, as an adult, what shots or boosters, if any, are important to get? I question just about everything and do my own research. My wife went to the doctor, and they were pushing her to get a tetanus booster and hepatitis A. My default answer almost is always no. Of course, she wanted to know why I said I would say no. I always thought you got a tetanus shot when you got a deep puncture wound. So what are your thoughts on boosters? Which ones are important to get in your opinion?
I don't get involved in that debate. There's been some really wonderful, incredibly brilliant doctors that had their practice ruined by the people that had a different opinion. There's plenty of websites, although they're being censored, nothing like freedom of speech here in America, that are anti-vax, and then there's some that are pro-vax. I think you should read both sides and then make your own choice. I wonder why they put so many horrible, horrible toxins in the vaccines, but I asked that to a PhD one time, and he got turned red-faced and didn't want to talk about it. I said, well, explain, the efficacy there. But I don't give advice one way or the other. That's outside of my scope of practice.
That's good. Okay. We have Richard here that has a question about bouts of SVT, which is supraventricular tachycardia. He went to a specialist. They want to put him on beta blockers or have a surgery called ablation. Is there a way to treat SVT naturally? He gets them 1 to 3 times a month. Some last for hours, some a few minutes.
Well, first of all, going to the specialist was a really good thing. We have a lot of good cardiologists out there. Me, as a chiropractor, I've seen plenty of times when they get a proper adjustment. Notice I say proper, and notice when I say a supplement, I'll say good, because that implies there are some bad ones or halfway ones out there. Go see a cardiologist. Is there a natural way? It's like, well, I've seen adjustments where, oh my God, their heart started beating correctly, and sometimes it's a magnesium deficiency, sometimes it's an imbalance with the different minerals. Sometimes you need to take a good multi-mineral, especially the chelated ones, the TRAACs, TRAACS, and because that can begin to push out some of the heavy metals that can cause these things. I've seen it be much more prevalent in people that are around more chemicals than the average population. People that spray pesticides, hairdressers, nail techs, welders, they seem to have a lot more of that. And then there's all kinds of good books that talk about that. So you treat it naturally. Yeah, you just want to get your body in good shape, but you want to see the specialist first and foremost. The ablation, again, outside of my practice, or scope of practice, I personally think the chiro ablation is much, much more effective and potentially less damaging than the radio frequency. But again, talk to your cardiologist about that.
I know that a lot of people that have that problem also take methyl supreme because it seems to help some. I'm not going to tell you it's going to fix it. I'm just telling you the ones that have this problem seem to do that because I guess it's the higher dose of B12.
Yeah, with the B6 and the 5-MTHF. So if you want to question that some more, go look up 5-MTHF-R, which is 5-methyl tetrahydrofolate reductase, and read about that. And when I take the methyl supreme, it makes my heart beat much, much more effectively because sometimes it'll flutter if I don't do the right things.
I always thought it was me that was making your heart flutter, but oh well.
And I didn't tell her about it, so yeah, absolutely, sweetheart.
I love these questions. These are so cool. These are not anything we would think of on our own.
And I didn't know they were coming, so.
Yeah, well, you're going to get another one here.
Good.
This one's from Janet, not me, Janet, but a different Janet. Hello. I have recently had an upper endoscopy, balloon dilation, swallowing issues, mild gastritis, and mild gray A esophagitis. some inflammation in stomach and esophagus. What would you recommend? Also need to gain my weight back. Any suggestions?
Yeah, you need to probably get into our wheat zoomer and food sensitivity test. That has helped us discover many, many things, the food sensitivities that can create that. In the meantime, you can take something called Indazine, which is zinc carnosine with glutamine. You can take our GI. What's it called?
GI support.
Yeah, because it's got glutamine and some other things that help heal the lining of the GI tract. Probiotics, yeah, big time. And we have several different ones that will not upset your stomach when they go into battle with the candida. So, yeah, there's a lot that can be done. I'd start with the wheat zoomer.
Cool. And I want to this isn't a question. I just love it when people have a positive response, and I'm going to read it. This is from Jennifer. She said, I'm a newbie here just checking in. 9 days of eating right, sweating every day, and taking my supplements. Oh my God, I've lost 7 pounds. No detox fog and energy. I'm closing down Splash Kingdom with the kids, no problem. Ain't no looking back now. So you got to love Jennifer because she gave some positive feedback. She's looking for what's right. She's getting what's right. And she's inspiring others to hang in there. So thank you very much, Jennifer, for the positivity.
Well,
love the positivity.
The thing is, the people that get positive results are the ones that call it before it becomes true. They look for something good, and the people that look for crap find crap. Man, I'm sorry I didn't clean that up. But if you're seeing a bunch of nasty negativity in your life, it's because that's what's in your spirit. You need to change your attitude. Because I just called a lady yesterday, and she said, "Oh, this is better, this is better, this is better. I'm jogging right now." And da 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 da. She just went on and on and on. She says, "I'm sending half of Longview to see you." It's like, yeah, we get a lot of mostly positive people, and it's like it encourages us, especially when Kara will email me and say, "I hope you're safe during the hurricane." It's like, yeah, we got some wonderful people, so thank you. We need the encouragement too.
And speaking of another wonderful person, this is Alan from Maine. He's been with us forever.
Many years.
Yes, and he is, you can tell by the way he writes, he's very educated, and we appreciate that you would listen to us, Alan, and hope we can inspire you with some answers here, because he has a question for Dr. Lewis about his opinion on the annual flu shots. He understands that the influenza virus mutates regularly, so a vaccine may not prevent the current flu strain, but I'm told it lessens the effects. In light of the SARS-CoV virus, would it be wise to get a flu shot this year to help reduce the cytokine storm associated with influenza and SARS and COVID? Context: you're speaking to a group of people who follow your advice and purchase your products, is what he put. Thank you, Alan. That being said, would you advise your clients to purchase specific products in addition to their regularly purchased supplements in order to help them resist any adverse reactions to SARS-CoV? Wow.
I try to do everything naturally. I might take my 50,000 D. I take the D3K2, and I sometimes throw in the 5,000 straight D.
I can tell you exactly what we'd recommend to help some of that.
Good. I take quercetin, bromelain, and immune essentials. If you read about the research on those mushrooms, you'd just be scary not to take them.
Yeah, the immune essentials, they're fantastic. We have ViraPro, which is for viral things. Mm-hmm. We have you always need the probiotic, which we're doing the ProBioEase. We have zinc complex. We're telling you to do all of them. We're not just telling you to do one thing, because I have some people go, okay, which one? It's like, no, all of them.
Which gallon of gas do you want to put in your tank to go from here to Montana? You fill it up.
The vitamin D plus K, just like we talked about. We have one called multi-element buffered C that has a whole variety of things more than just vitamin C.
Yeah.
That's doing really, really well. So, yeah, a combination of all of that. And I can honestly tell you that the people that have been doing that I know of have not gotten sick. And we're not going to tell you not to take a shot, because we can't do that. But that's up to you. But we're just telling you that these are things that can help your body naturally. So, sadly, I can't believe this show has gone by so fast, and I still had more questions. And I'm sure Dr. Lewis still had more about vitamin D. So I'm going to let Dr. Lewis say a little bit more about whatever it is he'd like to say something about, because we never know what comes out. So can you end our show with some inspiring words or something else you'd like to say?
Yeah, if you want to read more about vitamin D, look up Stasha Gominak, Gominak, and the reason I wanted to mention her is because she practices over there in Tyler. Last I heard, she's a Harvard-trained neurologist, and she's absolutely brilliant when it comes to vitamin D. So, she recommends taking 20,000 a day for a long time and then going to 10. But again, if you're going to do this vitamin D thing, you need to have lab, because you really don't want to overdo it. I'm going to tell you, if your health is important to you, you'll find a way. If it's not important, you'll find an excuse. One of the hardest things in the world is finding enough love for yourself to do this. So most of my people that follow me for years and years, like Alan, from Maine, he's a great guy. Most of them, they do it for the love of their spouse or the love of their children or the love of their grandchildren. And I have to admit, I'm guilty of that. I do it for Janet way before I do it for me. So you have to find the need behind the need. And once you kind of get on the road to good health, it kind of perpetuates itself. So, let's get started, have the courage to stick with it until it becomes a habit.
Speaking of getting started and getting courage, go to greenwisdomhealth.com. There's a health survey there for those of you that are new to us. Fill out the health survey. It will recommend a lab panel, or Dr. Lewis generally calls you himself to discuss any health issues you have. So he tries to keep it a personalized experience. And we'll be here next time on the Green Wisdom Health Show. You guys have a very blessed week.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.